Thank you, Vish. I'd now like to introduce both Susie Gates and Rebecca Poole, along with Adelaide and Vish, to come up and join the panel. We have two new faces on the panel. Susie Gates is the team lead of health communications at the Centers for Disease Control and Prevention. Susie, I'd like for you to just give an introduction and to add some additional remarks to the opening presentations.
This is a problem when your glasses don't allow you to see close up. There you go. I am, first let me say the disclaimer, I am representing my own views and not those of CDC. So I am the team lead in CDC's for communication and CDC's Division of Nutrition, Physical Activity, and Obesity. Hello, Bill. It is an honor to have worked with many of you here. It is an honor to work with many of the communities who are actually watching by webcast today. And I want to start by saying we have a slight revision to the definition of communication when we work in community health. And that is, it is the strategic use of marketing principles to advance programmatic objectives. So it's really grounding communication as part of a program and an integral piece of the effort and the pieces that get pulled on the table. So we're not talking about pamphlets and we're not talking about brochures from the 1980s. We're talking about strategic communication. And it is and can be an intervention, and it has been used to impact norms and advance policy systems and environmental change to make healthy living easier and more desirable. So much of how I think about communication started when I worked on the VERB campaign, and I was asked to specifically address some of the work that I've done and the communities have done today. So with the VERB campaign that Luis Garcia is going to speak with you about a little bit later, I learned two key things that have brought me through these 20-odd years. I won't count them exactly. And that is, find your audience with precision and know their barriers, know their values, and appeal to a common desire. So that was the first thing that really grounded that we have taken up through community health. And then also to grow and evolve with your audience and continue to learn. Because what we learned 5 years ago doesn't apply today. This was very obvious, but what we heard this morning. So in the years since VERB, and that would be CPPW, CTG, reach, pitch, span, hop, and every other alphabetical thing you could probably put together and spell a word, we have had communities doing this and addressing these barriers across the country. So I wanted to talk just a little bit about a few of them. One is New York City's Man Eating Sugar campaign and the sugar campaigns that grew from there, right? Another is Chicago's Deserve campaign. Both of those softened the ground for environmental change, for policy change. And you'll find that the communication plays a very key role in softening the ground nationwide. And others have gone on to address this and to use these same messages. Philadelphia did an extensive audience research, and they developed a child diabetes campaign for African Americans. And then Tri-County outside of Denver tested and adapted that for Hispanic audiences. So we're seeing, again, they're laying that foundation for the programmatic work that is happening. Santa Clara, California developed ads in English and Spanish to convey that children are drowning in sugar. That message was not just quite getting through. Tribes nationwide had developed radio ads to communicate. The Coeur d'Alene tribe has developed the powwow sweat to encourage physical activity among using native dance among their tribes that has actually spread across the country and come here to DC. Alaska has message encouraging parents to help their kids to play every day for 60 minutes and to serve fewer sugary drinks. So communities have wrapped delivery trucks and in low-income communities. And we have successfully delivered targeted messages to low-income, rural, African American, and Hispanic communities in the South through social media. So this is just a small sample of the work that's going on nationwide using strategic communication to win the hearts and minds of communities and advance obesity-related program objectives. The communities have learned, they have adapted, they have tested, and they have evolved their messaging. And so I would like to say that many of these that I discussed are actually available in the State and Community Health Media Center at CDC that my division sponsors. And it's been a privilege to work with you and with them to share the great work that's happening to determine the steps forward to make the achievement of healthy weight the norm for America. Thank you.
Thank you, Susie. We also have joining us Dr. Rebecca Poole from the University of Connecticut. Welcome.
Good morning, everyone. This is on, people can hear me. I'm really delighted to be here and to be a part of the important discussions that are taking place today. As a researcher, my work for the past 15 years or so has focused on the nature and impact of stigma and discrimination towards people who have obesity. And so I'd like to focus my comments on the role of stigma in our current obesity communications environment. I think it's helpful to acknowledge that negative attitudes towards people who have obesity have been ingrained in our social fabric for many years, and we need to consider that when we think about the information that we're communicating about obesity and how people are reacting to that information. Weight stigma remains common in our society, it remains very problematic, and it does interfere with our ability to effectively communicate about obesity. And so I'd like to share just a couple of examples of the research that my team has done to look at the role of stigma in obesity communication. One area of our research has examined communication in public health campaigns targeting obesity. And in several national experimental studies, we've assessed public reactions to different types of messages in common, widely disseminated campaigns to target obesity. And essentially what we find is when people are exposed to stigmatizing messages in those campaigns, that this results in less motivation, lower intent, and less self-confidence to change health behavior. But when people are exposed to non-stigmatizing messages, this increases their motivation for behavior change, especially when the messages focus on specific health behavior changes rather than on body weight or obesity. And so I think an important question in obesity communication is how do we generate public attention and how do we disseminate important messages without stigmatizing or shaming people in the process? Another area of our research has focused on assessing communication in news media about obesity. And a very common obesity narrative is often one that communicates obesity as an issue of personal responsibility and a problem that is caused at the individual level and should be solved at the individual level. That's a very problematic narrative. But it's not just that narrative that we need to pay attention to. We also need to look at the visual depictions of people with obesity in the news media. And sometimes those visual depictions send more powerful messages than what is actually being said. So my research team has conducted content analyses looking at visual images of obesity in the news media, and we've also done experimental studies to look at what impact these negative images might have on public attitudes. And what we find is that about 2/3 of visual images of children and adults with obesity are portrayed in a stigmatizing manner when they accompany news reports about obesity. And our experimental studies show that when people are exposed to those negative images, that even if the written content of the narrative is neutral, their attitudes worsen, their bias increases. But when they see non-stigmatizing images, their attitudes improve. And it's not just the news media that we need to be paying attention to. It's social media, it's Twitter, it's entertainment media. Research has begun to look at obesity communication in these other forms of media as well, with the same kinds of findings emerging. A focus on individual responsibility, on ridicule, and on stereotypes. So from my perspective, I think there is a clear disconnect with what we know about obesity as scientists and as health professionals and what is being communicated at different levels of societal communication. And then finally, I think it's critical to consider obesity communication in healthcare at the level of the patient-provider relationship. We know that healthcare providers receive very little, if any, training about how to communicate about weight and obesity with their patients. We also know that weight stigma can create harmful implications for those communication behaviors. And this is an issue not just for adult obesity, but also for childhood obesity. And in 2017, along with Stephen Pont and some colleagues, I co-authored a policy statement for the American Academy of Pediatrics, which provided recommendations for pediatric providers to use sensitive and non-stigmatizing language when they are working with children and families. So to improve the obesity communications environment in healthcare, we need to be asking important questions, including who should be involved in having discussions about obesity, what should providers be saying, and how can they communicate with patients in ways that are supportive and empowering rather than potentially shaming or stigmatizing. More broadly, I think that the evidence does indicate that there's a need for a shift in our current obesity communications environment away from a narrative that emphasizes obesity in overly simplistic ways and as an issue of personal responsibility and deserving of blame. And more fundamentally, that we need communication that is respectful and inclusive of people of diverse backgrounds who are affected by obesity. So I look forward to talking more about these important issues today. Thanks.
Thank you, Rebecca. So just in terms of format, so we have about 30 minutes for a panel discussion. I'll get the panel going, but then we do have 2 microphones in the room, and we would love to hear questions and also comments. This is a dialogue from all of you in the audience. So just to get started, we heard from Adelaide about the importance of a sender and a receiver. So in context of obesity, I'd like to hear your thoughts on who has been the sender, what has been heard, and then what has been acted on in terms of obesity communications.
Is it addressed specifically? Go ahead. Go ahead.
I don't have an easy answer for that. I think broadly, I can say personally, my experience and my career with an agency, I have not done any dedicated obesity prevention or treatment related communication, so I can't speak directly. But as a nutrition professional in working in the landscape, I have seen things that have been done by companies, I would say probably more likely organizations, nonprofit groups that are dedicated to improvement of the health of Americans, and then more, I have experienced seeing more community and public health campaigns related to obesity. But I welcome feedback, more informed feedback from the panel and the company I keep.
Well, I mean, so it's like you want us to give a 15 years program of research on obesity, right, on communications. It's not, I think that simply one sender, I think, so what, as I was alluding to earlier, there are multiplicity of stakeholders, who are communicating on this, I think, and certainly if you want to talk about sides, there are certainly 2 sides to this story, those of us who are in the business of promoting risk reduction and promoting, health, as opposed to those who are in the business of, promoting risk, what we call as a risk-producing industry. And it's not one group, but it's a large group of them. And we also, I think, did not mention earlier the entire notion of obesogenic environment. I think this in the entire design of not just communications, but how we design the system as society, and how that contributes to it, including the language. I mean, I think CDC has done amazing job in actually documenting some of these things. I think so. It's really these 2 sides, if you will. Those who are in the business of risk production, producing, and those who are trying to promote health, I think, so.
I would say that, harking back to what Vish talked about earlier, is that while we can all talk about information, I think the misinformation is far outweighing what the information is, and breaking through that and breaking through the clutter that you eloquently outlined there is our challenge. I do think that narratives hold an opportunity there, people hearing from people like themselves and norming it, as the woman from Lawrence, Kansas did. I think, so there is opportunity there. When we have on one, at the beginning of the weekend, Rihanna was having her fashion show of the different body types. And so we're norming, and that's fine, except that we want to be careful and not cross over into, norming unhealthy weight. We need to norm healthy weight. And how do we get equally strong messages, maybe not as strong as Rihanna's, but right there at the same time, and that Rihanna can carry that message of have a healthy weight and to be a healthy person. So I think we are in this time right now where we're dangerously close to going into unhealthy weight is the norm.
So I think going back to your question about what messages are being received, I think certainly people are hearing a message that obesity is an issue that they need to deal with on their own. I think that we have a collective understanding amongst us here about the complexities of obesity, but I think those complexities are not being communicated. And I think that's a key piece of this, because if we only focus on the individual piece, we're not going to solve this issue. I think in terms of what people aren't hearing in messages, is typically the messages are not inclusive of different demographic groups, whether it's age or race, ethnicity, or socioeconomic status. I think we oftentimes are hearing messages about the benefits of nutrition and physical activity for weight, but not necessarily for health, which is another way to frame some of these issues. And I think the broader social, environmental approaches that are needed to address obesity are also missing from what's being received.
So Adelaide, you talked about the seismic shift in communications, and Vish, you talked about the communications revolution, that we have so much mass information, we need simple messages. We just heard from Dr. Poole that we need to talk, there are complexities in this. So how do you take a complex issue and break it down into simple terms that people can understand and then act upon?
I think I would say that I agree with both things, meaning simplicity is important for some audiences. I think it's audience specific and objective specific. The oversimplification at maybe a mass communications or campaign level is likely not going to be tremendously effective. I think, Susie, you were saying one of the things that you learned along the way in your career is that hyper-targeting is critical. That's, with the complexity of the message, the environment, I would say, approaching it from an audience-specific mindset would be wise so that it isn't a single mass oversimplification of what is absolutely a complicated environment and lots to communicate. So I think audience-specific messaging is how I would approach it.
So I think we can take this notion of simplification a little too far, in the sense people are very sophisticated. I mean, they really can think. I think one of my favorite books is by Bill Gampson called Talking Politics. And he interviews, in-depth interviews with a group of quote-unquote blue-collar workers about really sophisticated issues about pensions and social security and so on and so forth. And he actually documents how thoughtful are these people in articulating the challenges with social security, right? So the point I'm trying to make is that people are actually very thoughtful. We did focus groups with single women who are from a lower socioeconomic position. And about inequalities in communications, they said, so how do you decide how you pay your bills in any given time? And they said, what? I don't pay my cable bill every month. What will they do? Cut me off? No, they want me as a customer. So I wait for 2-3 months because I have to make a decision. Where should I pay my bills? I don't have enough money. I'll wait for a couple of months. The third month, they're ready to cut the bill. And that's when I pay the cable bill, right? So that degree of really savviness in navigating through the issues is very much out there. I think the challenge, is we as a collectively are failing in really designing a communication systems and communication messaging that takes into account this kind of a sophistication of people and providing them the kind of support that is needed, right? That's why I mentioned and this is not my term, and Bill and others, everybody sitting here, the entire committee on obesogenic environment, because it is a larger environment that's really not conducive for them to process this and actually apply these messages, I think. So certainly hyper-targeting, focusing on specific behavior, like a group of people said, give us a menu plan. Yeah, that's true. But in a focus group we did in Mumbai, the kids from some of the slums actually eat a lot of potato chips, right? On the way to and from the school, they see these kiosks with beautiful decoration of potato chips, hanging. If anybody has been to India, you see the small shops, kiosk with these packets of sweets, chocolates, and chips hanging down. They're so attractive, and they're always hungry, and potato chips will help them, feed that hunger, right? So trying to really understand the context and providing information based on that context is very critical, I think, but people are capable of really deep thinking in these things, so.
And I agree with that, and I also want to just put out there, this is tricky in the balance of, if we overstress, this is the balance we face in the communities face every day. If we overstress their barriers of environmental barriers, does that lead to fatalism? I can do nothing about it because, and I think one of the ways, because of I have no good food in my neighborhood, because I have no access to safe places to play, because, so I can do nothing. Versus, that's why I do think that narratives and real people's stories and things that people are actually doing to overcome those, do the modeling that is needed in order to still stress it's not just it's not an individual issue, an individual's behavior, but it's also an environmental one. But we have this fine line that we have to walk to not overstress it.
So there's actually been some research done looking at when people attribute obesity to individual versus social types of contributors and what that means for their attitudes. And when people attribute obesity to more complex societal level types of contributors, they're actually more likely to support social policies to address those very things. And I think that we're going to have limited effectiveness in our messaging, regardless of how simple or sophisticated it is, if social and environmental policies and approaches are not taking place at the same time. And in terms of individualizing narratives, I think this is also an area where we need to walk a fine line. I think on the one hand, individual narratives can be very, very powerful, can be motivating and inspiring, and can allow people to see others like them going through struggles. At the same time, there is also some research that has looked at this in the context of childhood obesity being reported on in the media. And when news reports individualize the stories of individual children, it really tends to individualize the problem. They're not talking about multiple contributors to obesity. They're blaming the parents. And so I think we need to think very carefully with our narratives and when we are trying to show individuals and tell their stories, to make sure that it is a comprehensive picture and we're seeing the whole thing.
That's exactly what we found in our research too. I think if it's a question of what is the policy support or public opinion support, and I think and I gave the example of individual narrative of Elizabeth Ruiz, so that's interesting. It's attractive. Stories are attractive, but they can put a lot of pressure on people, because it's not that people don't know what to do. They know. Every day they face it. Every day they're bombarded by these messages. They're bad mothers. They're bad people. They're doing this thing. But that's not the reality of their lives.
So Susie, I'd love to go back to you. You mentioned the VERB campaign that you worked on within CDC. Can you talk to us a little bit about the strategy behind how you targeted the audience, the message perhaps that you came up with? Was there a narrative behind it? And then what was the perceived outcome from that?
Well, I could, but then I'd get the evil eye from Luis, who was going to talk about it at session 3. But let's I'll talk it at a very high level, right? So at a very high level, VERB had a national kind of messaging and norming that then was segmented and Luis will go into this, very specifically by different ethnic audiences. And from an outcome perspective, we actually saw that it worked. It was, It's millions and millions of dollars. And it was a national effort that went to the different ethnic audiences, and then went local, because there were events and communities were doing things. So it took all of the levels to actually see effectiveness. I do think we could do something like that again, but in the meantime, I think that the ground troops, the people are there in the communities. If a direction is set, if objectives and key audiences are set, and we're all moving in the same direction, and that momentum is going, the people are in place at the community, state and community level to implement. It's just that the informed messaging needs to be there, the strategy needs to be there, because that is what kind of moved the country and was effective.
Thank you.
And I will stop there.
Thank you. And before I open it up to the audience, Rebecca, I'd like to ask you one question. We all heard that words matter. What words we choose do matter and have impact. Can you talk a little bit about people-first language, and especially in the context of public health, and where perhaps it has worked very well, whether it's a topic of obesity or another topic?
Sure. So this is another issue that seems simple up front, but is actually very complex. Language is getting a lot of attention right now in the obesity field and in other disciplines as well. People-first language essentially refers to identifying a person first rather than labeling them by their condition or illness. And it's been something that's been used for multiple stigmatized conditions and illnesses for a long time. And it's, in recent years, become adopted in the obesity field and the medical field. I do think it's a positive first step, especially in the medical field, because providers are approaching their patients more as a person first. And I think this promotes patient-centered care, which is really important. But it is important to recognize that there are many different perspectives when it comes to the language that we use about obesity and about body weight. There are about 20 studies now that have assessed people's preferences for different words that we use when we talk about obesity. Some of these studies have been done with adults, asking them about their preferences of what words they want doctors to use when they talk to them about their weight. Some have been done with parents, and some have been done with adolescents. And generally speaking, what we see across these studies is people really want neutral words to be used when their weight is discussed, whether it's unhealthy weight or high BMI or even just the word weight. Whereas words like fat and obese are really disliked by many groups of people. A couple things to note, though, is this work has primarily been done with white samples, primarily with women, so there's a lack of diversity in this research. To date, there's really actually only been one study done on people-first language. It did have positive findings in that it was done with patients seeking bariatric surgery, and they did prefer people-first language to be used. But there's a lot that we don't know. We don't know the impact of different language on quality of care. We don't know what providers are actually saying. And we're kind of at a point right now where we don't have a universally acceptable term or phrase that everyone is comfortable with. And until we get there, I think it really speaks to the importance of respecting individual diversity in preferences. And that's not an easy thing to do when we're talking about broad dissemination of messages to large groups of people. But it is a much more tangible thing to do in the context of a provider-patient relationship, where a provider can simply ask a patient, as we talk about your weight today, what kinds of words or language would you feel most comfortable with us using? So language really does have an impact. I mean, there's research showing that language, if patients feel doctors use stigmatizing language, they're more likely to avoid future health care. So we really need to pay attention to this, because how we talk about this is just as important as what we're saying.
Thank you. So now I'd like to open it up to our audience for questions. We have 2 microphones on both sides of the room.
Hi, Ted Kyle. I'm a member of the panel. And something was said on the panel about the danger of normalizing unhealthy weights. And I'd like to hear the views of various members of the panel. Maybe a few months ago, there was a very public controversy along these lines when Nike started using large models, large mannequins in their stores to model fitness clothes. And some folks in the UK said, oh, you're normalizing unhealthy body weights by showing those fitness clothes in large sizes. Whereas advocates for people living with obesity said, well, wait, are we supposed to feel abnormal and not feel like fitness clothes are for us? So I'd really like to hear the comments of the panel on that.
I'll speak to that. So, right now, a higher body weight is the norm. And I think that it's very important that we show diversity of body sizes in communication about obesity and communication about anything else, frankly. It's really important for people of high body weight to have role models of other people that look like them who are engaging in health behaviors, who can have access to clothing that they can be physically active in. So I actually think approaches like that are very important, and that we need to see more examples of people of diverse body weight in the media.
Nico.
Nico Pronk with the Roundtable. So this is for anybody on the panel, but it's stimulated by a slide from Vish, which was basically saying information does not equal communication. My question is, so there's been a lot communicated or distributed around obesity, but what makes a communication campaign different from an information campaign? So I'm thinking information, you can just send it out. Communication, I think more of as a two-way. You want some reaction to come back or some feedback loop. But when we do things like community-based communication campaigns, are they really communication campaigns then, or are they information campaigns? Can you speak more about that? What makes for a strong communication campaign versus really distributing information?
Sure. Maybe that was Adelaide's last slide she was going to go through. Maybe quickly, if you can do that, I can talk about the community-based campaigns and how I defined it. So please go ahead.
Yeah, thank you.
That was yours.
From an agency perspective, we would consider a communications program, campaign, any kind of initiative that starts with clear objectives and goes all the way through to measuring outcomes. What is done in the middle, how it's executed, what channels, is all to be tailored based on what you want to communicate and to whom. But it would be holistic in that it's not just shooting out information, and then what? What happens to it? What are you hearing? So you are getting that measurement and reporting of what's working and what's not, and then it's a feedback loop to, do we need to change anything in terms of how we're talking about it, to whom, and in what channels, and then we try it again and measure again, and kind of keeps going like that. So I would say from an agency perspective, it's comprehensive, and it starts with clear objectives, go through measurement, and how we do it in the middle is customized.
So just to build on that, so I think our thinking on community-based campaigns have evolved since the North Karelia experiment to the three famous CVD trials, Minnesota, Stanford, and Pawtucket, Rhode Island. So now I think what we have been doing is so-called community-based or participatory research-based campaigns. What we mean by that is really engaging the end users right from the beginning, right? So we do have, there is certainly asymmetry in power, right? Somebody is determining this is out of all the social conditions, this is a condition that we'll define as a problem. So we are saying obesity is a problem out of myriad of conditions out there. So that is determined by somebody, at CDC or federal government or whoever it is. But at the end of the day, I think we are communicating with a group. I think what we have been trying to do is really bring the end users to the table, even as we design the intervention and the campaigns. So the notion of using a particular kind of a language, particular channels, involving people, or what platform should be involved, much of it depends upon the kind of engagement we have with the community in which we are working. So we bring the stakeholders together and start, co-designing has become too much of a catchphrase, but it is really, it's co-designing that intervention with them. One of the examples, we often talk about social determinants. I hate the term social determinants. I personally prefer using the term social drivers of inequalities, because social determinants communicate sort of a determinist, immutable language, which I don't like. Okay, of course, these are mutable. This is not natural. These are constructed, these inequalities. So our community, one of the communities we work in, Lawrence, actually hates the word disparities. They told us right at the beginning, don't use the word disparities with us, right? So when you engage the end users right from the beginning, I think you are able to some extent figure out what language to use, what platforms to use, and your measurement and other things become much more easier, I think.
So then when it's specific to obesity, would you say the communication campaigns are more effective if you couch obesity in a broader context versus sort of focusing in on an obesity communication campaign, which is very specific, but may actually lack that piece of engaging people to the point where they change behavior?
Again, others can jump in. There is a history of campaigns. We have published a meta review of narrative review of campaigns. For 25 years, we reviewed all the strategic communication campaigns. Others have actually done some reviews on it. It's very clear there are few lessons we can learn from the successful versus non-successful campaigns. And the successful campaigns invariably involved contextualizing it, right? Looking at the context. This notion of really looking at changing the environment while we are also focusing on individuals. Individuals do not behave in vacuum. They behave as a part of a structure, right, of an environment. And the campaigns clearly show if you do not have social supports and environmental supports, these campaigns don't work, right? It's very clear. I mean, the review we have done. So it's absolutely essential, and I think others would agree that to really do something like this. You walk into a grocery store, a bodega in Lawrence, which are not just places for shopping, right? These are community hubs, so to speak. What do you see? The first thing you see is a 2-liter bottle of Coke on sale, right? The vegetables and fruits are backed, right? So I can't go and tell them change your entire shopping structure or architecture of your shop without engaging the shopkeepers, right from the beginning. So I think that it's very clear that contextualizing it and involving and engaging the community is absolutely important.
And I know Shariki's coming, but just to build on that, I think you make all excellent points. And what I would add is that answering that question specifically is I would suspect that probably would be the case, meaning based on, Rebecca, what you said, talking about some of the language, what's resonating, what's not, certain words that are offensive right now. We may find, if you dug into specific audiences, that the use of the word obesity, that not me, or turns them off. So would we remove it entirely from our vernacular? Probably not, but you probably wouldn't lead with that. All other audience-driven, cultural, broader insights out there is that whole health is more relevant to, again, this is broad consumers, not specific, so it might not be true for all population groups, but talking about functional health in a very specific sense hasn't worked effectively for broad communication. So those would be other considerations from the planning perspective, getting to know your audiences, who you're speaking to, and what works, what doesn't, and then you kind of use the words.
And we know that diabetes among certain groups is more of an in than obesity. We know that high blood pressure is more of an in. You have to listen to your audience. It's always audience-driven, objective-driven, and piece of a full program.
Shariki.
Okay, thank you. Shariki Kumanyika, the round table. I want to pick up on some of the diversity issues that have been mentioned. Rebecca mentioned that a lot of the research about how people perceive language has been done on white women, and Vish has mentioned some of these things as well. It made me realize that the best approach for one population may actually be counterproductive for another one. And I don't know that we talk about that enough, because as the population becomes more diverse, the idea that weight control at the level where it's recommended is a preoccupation of white people, who want to be too thin in some communities. So I wonder how we can manage that now with all we've heard about the number of messages. Do we need, on the research agenda that we'll get to later on, to really think about how the other, say, race relations and ethnic relations contextualize the way people hear the messages and get the message so that it doesn't harm a population. So it's probably a comment, but I'd love to hear your comments on it.
I think that's an excellent point. And I think it also speaks to the fact that we need to make sure in the research questions that we're asking or the language that we're testing that we're even soliciting the right language from different groups. We may be missing terms. One thing I will say is in the language studies that we've done national samples to try to look at some of the sociodemographic differences and preferences. And we actually didn't see any differences in our personal studies, but there really hasn't been enough done with diverse groups of people. And I think you're right that even in some of the work we've done with adolescents, we're seeing gender differences in what girls feel comfortable having, what words talk about their weight versus boys. And so there are a lot of levels of complexity here where I think the messaging can be influenced in diverse ways based on that information.
Well, and I also think that we look at, let's just pick parents because it crosses a group, right, of all ethnicities. And there are universal kind of values that parents have. They want good things for their kids, just across the board. And so the message, and so appealing to that kind of helps cross over these individual messaging. I think that we absolutely have to consider the unintended effects. If we're going after, a white female audience, what's the bleed over into the rest of the population? We absolutely have to look at that for the unintended effects. But if we're looking at more common things like parents and that value system and where we can appeal there, I think we're kind of safer. But I think you raise a very good point, and we need to look at that.
Yeah, I think, in general, I think there are 3 points. So one is in most campaign effectiveness research or campaign effects research evaluations, we don't measure unintended effects, right? So that's not a part of it. Where we bothered to measure them, we actually find some surprises, unpleasant surprises sometimes, right? So that's one. I think we should do that. Second, this notion of issue that comes up with diversity, different groups, and inclusiveness. One of the challenges we have is most national surveys. I was trying to explain that in the one slide I gave 2 seconds for you to see. Most national surveys do not have people of diverse groups in the national samples, and then they end up saying, oh, sorry, we can't do subgroup analysis because we don't have enough people in the cells. Well, you don't have enough people in the cells because you did not design the survey in the first place to account for that kind of a diversity, right? So naturally, we don't have very confident way to draw inferences because we don't have enough people, I think. Third, I think it has become very clear from the campaign effects literature that I think we do have to have these campaigns with very diverse audience groups. And it doesn't easily cut across. I think in advertising, it does because it's a very simple message, right? Either do you drink Coke or you don't drink Coke. But for us, it's much more complex. I think obesity is a complex issue. Healthy weight, as we say, is a complex issue. And for us to communicate, we have to really look at different audiences, as you were saying, not just audience, but audiences, and really track regularly, what kind of impact we have and have that mid-course correction we need to make.
Thanks.
We'll take one final question.
Thank you. Thank you. Jamie Ard, roundtable member. So one of the things that I have thought about a lot from the treatment perspective and a provider perspective is the sort of declaration and recognition of obesity as a disease. And that was a major sort of change in the way that, the AMA thought about obesity, and there was a big hurrah in 2013 when that declaration was made. But from a communication standpoint, I feel like there's been a lot of unintended consequences, or maybe even expected consequences as a result of that framing. And I think fundamentally, from a science standpoint, it's correct. But the communication component to the public, as well as to healthcare providers and other stakeholders like insurance providers and so forth. That has not gone as well as one might have hoped after that Sentinel event. So I'd be interested in the panel's comments around how do we communicate that better? How do we change the perspective? Is there something that we need to be thinking about differently that helps us really firmly move obesity as a disease into a sort of common space where people, when someone says that, they understand what we mean. And I am very well aware that, after having spent a weekend with several other people who, are experts in the field, if you asked us to all describe obesity as a disease, you might get any number of different responses to what that really means in terms of health and implications of excess weight.
We've done a little bit of research on this. When that announcement came out, we were curious as to what public perceptions might be of this declaration. And so we did a national study around that time. And what I can say is that, a lot of people weren't aware of it. And when we asked questions about, do you think this is a positive, a negative, stigmatizing, not stigmatizing, that there were really people on both sides. About a third of folks felt, this disease classification is going to remove the shame and blame on me that I have felt for so long. It's going to recognize the complex social drivers, the environmental aspects, the biological aspects, and finally there's recognition that it's not just my fault. The other group, about a third of people, felt that this was going to actually increase stigma, that there is stigma associated with a disease status, and that many people feel like they don't have a disease. So I think it's, again, a very complex message to try to explain to a patient, and that this is an area where we really do need to pay more attention.
Now, where we've taken it down into focus groups, we have seen that people are more, I don't think tolerance is the right word, but understanding of people with obesity. So if there's a good outcome, that seems to be one that the people who may have pointed a finger understand the complexity, that this isn't just a personal choice or personal actions. But I do think this is a good example, going back to the question about sending out information and whether it's communication. Communication is strategic. And somebody before, when the research, and this is not to get into the hallowed halls of science, right? But when you're going to put something out, to understand and have a communication plan around that announcement and understand the parsing out of information for something so big and how it can be delivered to different audiences would be a good idea for these big announcements.
Yeah, all I have to say is that different messages affect different people differently, and I think and that's a given. So the question for us is to really wrestle with, when organizations that are in the business of generating and disseminating these kinds of information and labels should have some sense of obligation of understanding what is it the kind of impact they will have when they make these statements. Routinely research agencies, in fact, every university does it. We publish a paper, they want to write a press release about it, right? And we try to, it's not a good idea to always write a press release, but the point is, I think, and again, this is a system issue, I think, rather than individual issue. How do we design with this idea in mind and understanding the impact on different groups and what it could do, so.
Thank you. I would like to thank all the panelists, and please join me in thanking the panelists.